Hello, you guys, and welcome back, I guess, to our second lecture. Thank you very much for your participation. I saw your comments. I've been reading your comments, and the idea of these lectures too is to address some of those, and quite interesting. I hope you enjoyed the first lecture. That, of course, was meant to be an introduction into what we're going to review here, which is this entire area of research and study and inquiry, which is the link between healthcare, medical practices, relationships with between illness and communication and language and each other. So anyway, we are definitely going to go into our second lecture this week. This Team 2 already uploaded their chapter presentation, which is Accounting for the Visit, Giving Reasons for Seeking Medical Care, which is very interesting. It's interesting, I'm saying that because as some of you may know, I teach this other class this quarter and most quarters, which is Identity, Difference, and Communication. And we talk about Michel Foucault this week, which one of his biggest accomplishments and intellectual production was actually around institutions of healthcare institutions. So, la clinique, hospital, doctors, the medicalization of different illnesses, what constituted illness, and he compared them through time, through cultures. A very interesting thing. In this lecture, I want to talk a little bit about that. But before we even go into this, which anyway, I'm letting the second team to present this to you guys, and I saw it and it looks good, and I hope that you guys enjoy it as well. Leave your comments so next time we'll talk more about it, but definitely this particular chapter, quite interesting thing that we're going to revisit here a little bit too. Last time though, and to start with the summary of lecture 1, we, like I said before, we talked about healthcare communication science. We discovered that healthcare communication, it is a thing, and what characterizes this particular area in our field is actually the interdisciplinary nature of healthcare and communication. Healthcare delivery, health promotion, health promotion is one of the most important aspects, or I guess that areas in this particular field. And then the other thing that happened last week as well, and we need to discuss here, was the first team, which presented their chapter, Illness Narratives and the Social Construction of Health, which was very interesting. I hope that you enjoyed it as well. I saw some of the comments. Yeah, I mean, when we talk about narratives and social construction, which are the two main concepts in these presentations, so a couple of things for once, right? Like, well, there's a couple of things that we need to discuss. One is this: we tend to think of knowledge as being objective. Now, particularly in these times of very heated debate about what constitutes reality, alternative facts, and that kind of stuff, post-truth and so on, which we have grown accustomed to, unfortunately, to some extent, which it has divided the country, and certainly we have seen even the consequences within our field in the communication and healthcare in terms of, for instance, active access movement, this defiance, or kind of like this distrust for what used to be a very widely accepted opinion that the best way to approach health problems and what an illness is, and taking care of illnesses and sickness was the positivistic paradigm, which is basically what we call Western medicine and vaccines, among other things, but not only treating illnesses in a certain way, cancer and so on, using data-driven knowledge in order to treat them, right? Which is not just in the medical field, but actually other fields, including this, what I'm teaching here, social sciences. But that has been eroded to a great extent, and not surprisingly, actually, one of the readings, or rather what I proposed as an online discussion, student-led online discussion, was around what is happening right now in Italy, all over Europe, and in the States as well, where we are confronted with this paradox, right? We have had a very strong, in Italy, I'm talking about in terms of the reading that I gave you, we have this very strong movement that has exploded even, and it was part of like their political base, this distrust towards vaccines, and now they are in power. They are the ones that actually need to take care of like recovering from the pandemic, which, as you know, Italy was one of the countries that suffered the most last year to 2020 when this started March, April. They went into a heavy and long confinement. They're still dealing with that. But then now, those who actually call vaccines unsafe are confronted with what the necessity, if that's what they have decided, to vaccinate an entire country. So that actually presents a very interesting dilemma, and certainly is related to our field. So illness, again, the idea of narrative and the social construction of health. The reason why I gave you that particular reading, and we're talking about this, knowing that this was obviously the chapter that you guys need to review. Even though we tend to think that, again, knowledge, language are objective, in our own experience of sickness and our own experience of illness, as the chapter presented, the team did a really good job presenting that. We know that, including myself, we make sense out of it and we explain it to ourselves and to others. In this particular case, those who are in charge of our healthcare, like doctors, nurses, and so on, in a rather narrative way. So we actually build it and we make sense of certain feelings and certain areas and certain ideas and the pain even, and to try to turn it into a narrative, into a story that we can share with others. And the story needs to be understandable for others. But anyway, in that particular chapter, we talk about the transmission approach and the constitutive or constructionist approach, which is, in one, again, the transmission approach in communication just means it's a very old a paradigm, a very old model, which you probably know, the Shannon and Weber model, which basically states that communication would be, for the most part, the transmission of stuff. So I say something, I have an intention, I use a certain channel. It can be my voice, can be this video, can be visual, audio, both, body, and so on. I send my signals, and they are received and translated or interpreted by the other end, and then there's feedback and so on. You probably, if you study some communication, you know that particular model. Now that model is good, but it's not complete, and this different approach, the constitutive or constructionist approach, which is what was discussed, is rather different. It's that this idea, and it's related, of course, to the idea of the social construction of language and health in this particular case, is that in order to understand that we within communities, language community, cultural communities, we actually are creating constantly. We are co-creating, if you wish, meanings, the symbols, the language. So it's this distinction between objective and subjective language and terms. Now the narratives are using precisely, and that's why narratives are actually linked to certain communities and certain groups. Very important concept too. In my particular case, I speak several languages, and I have lived, and I still live, in different cultures, in different societies that, have different reference, and they have different narratives, by the way. So in other words, like, let me give an example that you may know. Growing up in Chile, my grandmother, my grandfather, until even myself, actually, I do it to my kids. We learned from a young age that walking bare feet may actually cause a cold, and I know that. I mean, we if you believe in microbiology, then I guess that that it's not that. Then again, I guess I justify it. I have done the narrative and the storytelling to myself, saying, and I have tried to understand how that is possible. Is that when your body is too cold or too warm, or you are not at your peak, you actually are more likely to catch these kind of viruses and also bacterial infections as well. So there is a relationship there, but there was this very clear understanding, and I remember that being a kid, that just by the mere fact of walking without shoes, it just may cause a cold. And there's a lot of things that we think about that we believe, and there's those narratives, but they make sense, I guess, right? Anyway, it's just a story that I wanted to share with you, but just to explain, because it actually resonates with me as well. So the experience of illness, and that's important, it is an experience, right? So being sick, we don't see the microbiological level of those little guys. I'm actually using a narrative as well. It's just like I personify, I humanize these little thing, viruses and so on. I'm sure that when you can draw, I guess COVID-19, it probably would be ugly. I don't know. It can be funny as well. Probably not funny, but ugly rather. But it's the experience of illness. It's something that we describe and we use words. And if we're not experts, we can still communicate how we feel and how to explain to a doctor, for instance. How do we make sense of how we're feeling? So narratives actually allow us to communicate, but some of the most important aspects of a narrative when it comes to healthcare and in the context of communication theory is this: it's a sense-making device, right? So expresses the blame, responsibility, control. Who is responsible for this? Once again, I didn't listen to my grandmother, or they told me do not walk with your feet, right? Then I got a cold, so I guess that is my responsibility, and it's a quite interesting thing. Things more complicated, other kinds of illnesses, or if we may call it that, right? And the way we call it, and this is Foucault, what I told you earlier, Michel Foucault, this idea of like how we medicalize and why and who decides what constitute an actual sickness. I mean, I was just sharing with my students just earlier today in a different video for my other class. I wasn't able to sit. You can probably see that, and those who know me already know that, to be able to just sit growing up in school for hours and hours and just listen, take notes. I was, in other words, not a good student in that sense, or at least a disciplined student. Well, I don't even know actually what to call it. I just couldn't sit still. I have a doctoral degree. I wrote a thesis in English, Spanish, and French. I guess I can safely and assumingly say that I have, done well when it comes to learning, academia, education, and all that. But believe me, it was very hard for me just to finish school. Every year was hard. So now we have all sorts of terms that at the time we didn't have. We have other terms, so they're equally kind of like harsh, like attention deficit disorder. Now, keep in mind, I'm not trying to say, because I'm not a doctor, right? I mean, I am a doctor, but not a medical doctor. This idea that it doesn't exist, but all those narratives, because it's syndromes, and we tend to talk more in a more complicated, but actually complicated may be a good thing, and more complex rather way. So we have certain signs that display a certain behavior, and that behavior may be medicalized. So somebody who behaves in a certain way may be declared crazy. Again, Michel Foucault, this French intellectual, actually wrote a book, several books and papers about that. This idea of like, who decides what crazy is, right? Who decides what sickness is? Who decides what illness is? So anyway, so storytelling, and this would definitely agree. So this communication theory with Michel Foucault, the idea that storytelling increases the sense of control. Now, in storytelling, using this within our context is really referring more to us making sense of things that normally don't, like being sick. I mean, how is that, right? That doesn't make any sense, but then we try to put in a certain way, like I will get better, or I won't, which actually has very important consequences too, or I could, or what do I need to do in order to get better. And another aspect of this is actually how storytelling and narrative, and that's why it is inscribed within social construction and social construction theories, this idea that it builds community, because language exists within communities, and actually we're fully human, and we can only fully communicate, and that's why actually communication is inherently a social act, and language is a social act as well. So the narratives, they display the appartenance to a social group, so that's important, and also actually builds this social group, so builds community. In other words, narratives and storytelling somehow build the communities. Now, somewhere about that too, because I always tell you, and we need to take this critical edge to this, I think that's important, right, is that what we consider and label as unhealthy or bad behaviors, I mean, they differ. These stories, these narratives, this social construction, I can give you some examples. I'm going to do it right now, but they are very different from place to place, from time to time as well. I'm going to go back to Michel Foucault, sorry, but it's my favorite. It's the favorite of the day and the week. Think about, for instance, sexual behavior. We're going to talk about food as well, right? But let me start with sex and food, I guess, but sexuality, right? What constitutes a good, we even words like decent and moral, correct ways of express sexuality, right? In a place like the United States, very interesting thing. But and this has been my own anecdotal experience, but also intellectually, we know. I mean, since the beginning of the American Republic, we have seen this. I mean, where it comes from, historical records and all that. But the very strong Christian mores, and a Protestant Christian mores too, which we normally associate with Protestantism of a certain kind, and particularly Puritanism. But this idea that, for instance, very capitalistic too, Michel Foucault would say that this idea that sexuality can only be correctly healthily expressed within marriage, for instance, right? Or between a male and a female. Those kind of things actually, again, I'm not trying to tell you that, particularly the male-female thing, that please, I'm not trying to convince you or indoctrinate you or anything, but this idea that those are normal and any other deviation from that would be abnormal. I just want you to think about how those can show what we have as a community come to accept and define as correct, good, and so on. Now, something less dramatic, I guess, is like, for instance, the relationship between these narratives and food. I'm going to give you one, and this is going to be, I believe, almost the last one before we move into the next and last thing. What constitutes good food? I always perform this experience with students, in different countries, particularly France, between France and the States. Now, this is a huge generalization, but for the most part, it's correct, or at least is valid. So, in the States, if I ask what constitute, what is healthy food? How do you recognize healthy food? I mean, in the States, we have an approach that it works for most people, which is the idea that you're not going to agree with me probably at first, but this idea that if it doesn't taste good, it's good for you. I want you to think about it for a while. So you take everything that's flavorful, which normally means fat, butter, that kind of stuff, and then, well, I guess it's good for you because it doesn't taste good. And in France, it's exactly the opposite. Something that tastes good has to be good for you. Now, there's a little trick there, or there's rather, it's a little, it's a trap, because what I'm trying to say is that here in France, although because of developments, just like in the States, well, many different things, but here actually foods that taste good, they are supposed to be better. Now, does McDonald's, which to be fair, fast food, the number one country in terms of per capita consumption in the world is the United States, and probably you don't know that, but the second country is France. So despite the fact that actually in France we think of ourselves as like, whoa, eating the best food in the world, which is probably true, we actually eat crappy food just like Americans do. But something that is very different is that we do that, but I guess that we deny it, narrative, right? And we tell ourselves something different. So we try to make sense. It's like, well, yeah, but actually we do have a cuisine that blah, blah, blah. And in the States, we actually, it's interesting because we eat this bad food and then we create an entire subsector, economic sector, which is all these like good foods, I guess. But most of these foods actually are in my opinion too, and I'm not the only one, they lack flavor. So anything that is fatty is bad. Everything that is foreign for the most part is bad. And well, that's a complicated thing. But anyway, I just wanted to leave you with that idea. So, like things like, for instance, just to finish this, obesity. Obesity is a tricky thing because, I mean, whose fault is it? And we talked about it in the previous lecture. Is obesity an individual choice? Is something that we decide, like I'm going to eat bad food, ergo, blah, 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 or fatty foods and so on? Or is rather an expression of other conditions, like, in that sense, very structural, meaning that, lower income means less access to good food, particularly in the States, but not only to good foods. Actually, that's a universal rather thing. So we go for like very dense foods that taste good, they make me feel good, even though they do not contain proteins and so on, or good quality nutrients. But anyway, but it's what I can afford. So do we blame it? Do we blame it on the individual? Should we blame it on society? Those narratives around the idea of health, those narratives around the idea of like what constitutes good or bad food and obesity, we can actually use them and dissect them using, again, social construction and critical theory. Like I said, Foucault and others saying like, well, who says that and why they're saying that? Are they actually creating this good versus bad food without realizing that really good food means expensive food, which means that actually rich people are better than you because they can actually, go and buy food in, what's the name of that thing? Whole Foods. There you go. Good luck with that. I try it and man, I hold paychecks and so on. Rather than Walmart, which actually can, you can afford more, but the quality of the food is arguably lesser. Anyway, I think that that's enough for now. And just to finish, I saw a lot of your comments. This is again, I start with this vaccine skepticism and how in Italy, the problem, like I said, we're confronted with that in the States as well. We have currents and undercurrents of people disregarding vaccination as something that is unnecessary and even dangerous. On the other hand, we are confronted with globally, that's why it's a pandemic, with this problem that it seems, if we believe in microbiology, which I do, the most certain way to solve this issue safely and rapidly, and essentially, because if we don't, unless of course you don't believe, which I mean, either way, I mean, the virus doesn't mind if you believe or not in a virus. You're still gonna get contaminated, unfortunately. But the things are the solution, right? What is the solution? So in Italy, we have this huge paradox where the very same government, the coalition, not entire government, but some of the parties and groups within the coalition that is in power in Italy right now. Although actually 2 days ago, the 5-Star movement, I believe they kind of like left the government, so they need to find a new government because they have a parliamentary system, so it's complicated. But right, and now, how do we do that? And we need to change the narrative. We need to change the story, and I guess that we need to kind of like confront. This is something that happens often, as you have known, with QAnon and so on, where certain conspiracy theories, also religions, by the way, they certain set of beliefs, right, paradigms, they announce certain happenings, those happenings don't happen, and then actually then we need to go and review in retrospective our system of beliefs, and then we tweak it so it makes sense again, and so on. With this vaccine though, it's kind of like interesting, and I'm going to say something that I don't know if you're supposed to, but somehow reality has this way to bite you in the rear, and in this particular case it's a very serious situation where we may even, I wouldn't say it's a species, but there's like serious consequences to what's happening right now. So this is particularly relevant. Anyway, guys, I hope that you enjoy this. I try to keep it a little bit shorter than last time. Last time it was a little bit long. I'm asking you a couple of things. I'm going to send you soon an invitation for a next week, so we can actually meet. Zoom meeting, once again, is not mandatory because it's an asynchronous class, right? But if you can make it, I really hope you can make it, because then I can address some of the questions you may have, and we can discuss maybe events which I have tried to address, but some of you still have questions about how the course goes and the lectures and where things are. So I can more easily and faster to answer those concerns on a meeting, right? I mean, that's one of the beauties actually of like meeting face to face. But anyway, so wait for that invitation. Let me know, and well, I will see you guys like this next week, and well, for the lecture, but also for our meeting, hopefully most of you. And that's it. Enjoy the readings. I'm going to leave you with an article, or on this particular case, actually, I'm going to send you a podcast from NPR, which I hope that you enjoy, and it talks about, well, right, inequalities in healthcare. So we talk about that next week, I guess, once you listen to it. Thank you guys, and talk to you soon. Bye-bye.